There's a lot to migraine that is more than headache. And if you're nauseated, vomiting, can't come out in the light, can't move around too much, can't work, that's a real disability, even if the headache wasn't the major source of discomfort during the attack. Well, in terms of migraine medications, there are acute medications which we use to stop an attack, and there are preventive medications which we use to reduce the number and severity of attacks. Acute migraine treatment means that you take something as soon as an attack comes on with the hope that you'll shorten the attack. Currently, likely the most effective drugs we have are triptans. Triptans turn off the firing of trigeminal nerves in the brain, and that's how they work. We still occasionally use ergots. They're probably not as effective and probably not as safe as a triptan. Anti-inflammatories are very important. Many of them are over the counter, although you often need a decent dose in order to stop a migraine. Migraines are inflammatory, so it's certainly rational to think that an anti-inflammatory could help treat a migraine. With preventive medications, you need to take something on a regular basis in order to reduce the number and severity of attacks. Historically, we've had a few medications that we've used to prevent migraines, including a few beta blockers, a few antidepressants, and a few epilepsy drugs. But none of them were developed for migraines specifically. That's about to change. The newest drugs that we have are called CGRP monoclonal antibodies, and these are injectable drugs that we've never had anything like this before. There are 4 companies that have these in development. One of the 4 has been approved by the FDA, and we're already prescribing it for migraine prevention. CGRP stands for calcitonin gene-related peptide, which is a major transmitter of migraine symptoms in the brain. When you get a migraine, CGRP is clearly released in the blood and the spinal fluid and even the saliva, so it becomes a good marker of having a migraine, and that became an obvious target for development to block that particular chemical. We typically think about prevention in people who get 6 or more headache days per month. That's not the only time we do it, but 6 or more headache days per month is a reasonable target. There are people with fewer than 6 headache days per month who may be candidates for prevention if they don't respond to an acute therapy. There are several other agents that are being looked at for prevention and for the acute therapy of migraine, which are a few years away. So hopefully the CGRP drugs will help individuals, but there's even other things that may be available in the near future should they fail.